Hi everybody, we're going to talk about cranial nerve 7 today. 7 is a confusing cranial nerve because it has two different actions depending on what part of the face you are in. So we're going to go through that here. So the facial nerve innervates the motor, is motor innervation to the muscles of facial expression. This often gets confused in terms of somatosensation. The somatosensation, two-point discrimination, proprioception is related, is conveyed in the chief sensory nucleus of the trigeminal system. So the facial is motor and the sensory piece is trigeminal. Facial does some other things listed there, but that's not what we're going to focus on today. So let's orient here. We're going to talk about the cortical projections. Cortical projections down into the brainstem. So we're here, we are in the caudal portion of the pons. We have some pyramids here that are starting to get broken up. The medial lemniscus here is starting to get to lay down, whereas in the medulla, the pyramids are real distinct and the medial lemniscus is really parallel, medial, and upright. We have where we see the big middle cerebellar peduncle here. This is the 7th cranial nuclei. This black line here is actually the exiting fibers of the cranial nerve. That will, I think these fibers right here are actually the fibers coming out. This nucleus right here is abducens. Okay, so we're going to talk about both the cortical projections down to the nucleus, and then we're going to talk about the nucleus and its projections through the cranial nerve out to the face, out to the muscles. So from the cortex, the projections from the cortex are bilateral to the muscles, to the part of the nucleus that innervates the muscles of the forehead, the upper part of the face. So here that is illustrated in red. You can see there's projections from here, from the left hemisphere to both sides. And on the right-hand side in green, we have the projections to both cranial nerve nuclei as well. These nuclei then project to bilateral sides, both sides, each one does its own side. The left goes to the left part of the forehead, the right goes to the right part of the forehead. And the projections from the cortex on the right-hand side do the exact same thing. So there's redundancy built in there. But then what about the lower face? So for that, the projections are contralateral. So from the left cortex, the projections are going down to the right nucleus, which then projects to the lower part of the face, provides the innervation to the lower part of the face. This, of course, happens, it's the same on the other side, I just didn't draw it to make it less busy. Okay, so what happens if we have a stroke in the left hemisphere? So if we have a stroke here, we are going to lose all of the projections from that hemisphere. So we're going to lose all of those. We're going to lose the contralateral projections to the lower face, and we're going to lose those bilateral projections to the upper face. But clinically, then, what does your patient look like if this is what has happened to them, if they have had damage to the cortical representation of their face? Clinically, they will still be able to move their forehead. They would still be able to raise their eyebrows. They will have lost, however, the ability to move the right side of their lower face. The left side of their lower face is going to be working just fine because it's still getting the projections from the less affected hemisphere. Okay, so bilateral forehead, still okay, they can raise their eyebrows. If you ask them to smile, however, they're going to have a droopy face and an inability to smile on that affected side. One of the questions people always ask is, Are you going to lose some control because you've lost some innervation of the forehead muscles? And it appears not. There appears to not be any sort of functional implication. This is truly a redundancy that's built into the system. Okay, so what happens, going back now, what happens if the lesion is here? So now the lesion is at the level of the nerve. Okay, so this happens not infrequently. It could be a complication from surgery, that somebody is doing surgery like in your skull area where that nerve runs after we kind of see it in the brainstem, it runs out on its way to innervate those face muscles. It can happen with a viral inflammation that's referred to as Bell's palsy. It can happen with a TBI or some kind of a crush injury. Damage could happen there. So this now, we've essentially like cut or damaged that peripheral nerve. It's a cranial nerve, but now we can think of it just like we think of our peripheral nerves. Once you have the projections that are leaving that, say, anterior horn cell, what happens if that is cut? And it's as though you've now got a lower motor neuron injury that's cut that whole nerve. So all of that innervation is now gone. It doesn't matter that the nucleus is still getting projections. It doesn't matter because there's no way for it to send its information out. So now, clinically, the patient, when you ask them to raise their eyebrows, they're going to have the same problem, both on the whole side of their face. They're not going to be able to raise the eyebrow on that side, and they're not going to be able to smile and move their lower face on that side.